Hi everybody, Dr. Jody Kinney. So today what I want to show you is where the nerves go if you have a lumbar herniated disc or a disc in your lumbar or lower back spine. So the nerves that come from this lower back area go to the muscles in the lower back, they go to the hips, and big portions of those nerves go all the way down the legs to the feet. So when patients come in and they tell me they have a slip disc or a herniated disc in their lower back, that compresses the disc down and the nerves in such a way that it can affect your lower extremities. You can have leg pain, hip pain. Sometimes patients get numbness and tingling in the backs of their legs or all the way down to their feet. Adjustments, chiropractic adjustments can help with that. That can help take the pressure off those nerves and alleviate some of the pain and the pinching and the numbness that you might be feeling. Now, there is an organic component to those nerves too. Those nerves don't only go to the legs and the muscles and the stuff that you feel. Portions of the nerves in the lumbar spine go to your kidneys, go to your intestines, go to your colon, go to your bladder and your reproductive organs. So occasionally, if the disc is bad enough, some patients might have bowel or bladder problems. They might have problems with their reproductive organs. Sometimes patients have problems with, moving their bowels, constipation. So any of those things are possible if those nerves are affected. So if you're having any of those issues, any symptoms with pain or digestive issues, bowel or bladder problems, anything like that, come into our office so that we can check you, see what's going on, see if you have a disc issue happening, and work the very best we can without drugs and surgery so that we can get that corrected, okay? So I hope to see you soon. Dr. Jody signing off.